It's only been 3 months since BookDoc was here in the studio to tell us about their plans soon after launching a mobile app, but the healthcare tech startup appears to be going from strength to strength. They just announced this month that a member of the Brunei royal family has helped it close a 7-figure seed round in dollar terms. Joining us once again in the studio is BookDoc founder Chevy Bay. Now Chevy, you've made no bones about your regional aspirations. You've tied up 7 clients, corporate clients, since we last spoke, and you've established yourself in Singapore and Hong Kong, as well as in Malaysia, of course. Yeah. Thailand, Indonesia, and the Philippines next on your radar. How are you going to do that?
So we have been growing rapidly, I think, in 3 months. But to grow rapidly is to find the key partners in every market. In Malaysia, we've done quite fairly well because we have a good team of people. So what we are doing, going to places like, say, Indonesia, Philippines, and Thailand, we're actually going to work with a local partner who knows the local business regulation, business culture, so we can grow rapidly at the same pace.
So you get embedded fairly quickly then in those markets. Yeah. The last time you were here, you're telling us that it's a challenge to find the right balance when it comes to hiring quickly versus making the right hires. Part of the seed round that you've just established, you want to expand your workforce. So how's that going?
The last time we spoke, we were quite small. I mean, when we first came in, we had a small office with 150 square feet. We had like 4 people working there. But when the traction was there, we started expanding the workforce. So currently, like in Malaysia, we have 20 over people. In Singapore and Hong Kong, we are north of 10 each. So we're about 40 over people already. So we are planning, like we said, to expand more. But again, at the same time, healthcare is not as easy as one will reckon in any other sector because it's very regulated. Yeah.
And you've also said that the seed round will go towards developing the second phase of your technological capacity. What would that second phase entail?
So the first phase was just booking like consumer to doctors. Right now we are doing the B2B, so we also have another segment which is the corporate. So all these 3 so-called modules must tie in. So if someone book, the HR will be able to see, the doctor will be able to see if someone cancels. So it captures the whole ecosystem. And the first phase is just that. And second phase, we're capturing like cost. How much is the employee cost, healthcare cost to a company? How can the company make use of the cost to optimize the productivity of the staff? How do they get better wellness program for the employees? How do they do something to improve the cost or reduction in cost to increase the profitability, at the same time appear to be a very caring company.
And the last we spoke, we also discussed the potential to tie up with insurers. You noted that there were some potential partners, but they wanted to be exclusive. Now, this concern about ensuring that there's productivity to allow for better profitability, would there then be a chance to include that insurance angle with the corporate clients?
Yeah, we also, because once we have the analytics of the health-seeking behavior, we know the cost, then with that, we will work with the corporate clients to reach out to the insurance and say, this is what I think the corporate will need. Can you make something for them? So we help them optimize their costs.
Now, something that you've done which is quite interesting as well, you tied up with Grab Taxi. Yeah. So what other types of verticals would you look to get on board with to really maximize your network potential?
Because the first is we want to improve access to care, which is healthcare, where a lot of people have issue finding the right doctors. With this platform right now, BookDoc, you can find a doctor. But after finding a doctor, you may have issue like driving there, you're very sick. Or in the city area, you have trouble finding a car park. So we improve the access to care, tying up with Grab Taxi. So in a nutshell, it will help people when they're sick. They just call up and the taxi will pull up. Land transport. The next we're moving is actually air transport. So we are putting all the transport system into the database. So to focus and target on the next phase is medical tourism.
And the beauty of startups is being able to identify a problem that exists and to seek out a solution for it. Sounds like you're attempting to do it. What other gaps then do you see that you can take advantage of?
I think, like I mentioned, the medical tourism side, there are a lot to be done. I mean, Malaysia government have been very adamant and supportive in pushing, but they need a platform, which I think our platform will be a good platform to work with the government and in this region to promote medical tourism. You know, the US exchange rate has strengthened quite a fair bit, making the tourism or the cost of seeking medical treatment in Malaysia quite more affordable, and we have good quality care. So we want to leverage on this to help more people get more jobs, get more business, and promote Malaysia to the neighboring countries.
Specialized healthcare services tend to be the focus for this medical tourism. So, for example, you've tied up with IJN as well as the National Eye Hospital. What other sectors of the healthcare industry would you look to tie up with?
These two main hospitals, you just mentioned IJN and Tun Hussein Eye Hospital. We also tie up with SGMC, which is a tertiary, well-regarded state-of-art. And we also tie up about 1,000 over clinics right now. So a lot of them also come to Malaysia for, say, dental or aesthetic treatment. So we are tying up basically the whole ecosystem to have more choices for people to come to Malaysia to seek treatment.
So you're seeing the depreciating ringgit as a draw for you and a support for your business in that regard?
Not my business, but I would say the whole medical community, because we are just a platform, a market platform to connect and unite patients or consumers with the healthcare provider. So we will help facilitate with the ringgit dropping or depreciating. Then it helps facilitate the ecosystem to grow faster, right? It's like someone putting on steroids or fertilizer to grow faster.
All right, well, thank you so much, Chevy, for giving us the update on the latest, and congrats again on the seed funding that you've just secured. Thanks again for joining us. That was Chevy Bay, founder of